What is up, world? Okay, I don't know what the hell's going on here. I don't know what's going on here. What's up, y'all? What's up? What's up? Let me get this. Let's get this straight real quick. What's up? What's up? What's up? How y'all doing? Hey, so today is Wednesday. We are going to be doing the NCLEX questions. I'm just waiting for people to show up. How y'all doing? If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. My name is Kevin. I go by the Boot Nurse. Talk about NCLEX stuff. Is it Sabina? Sabina? Do you mean Sabrina? Where you are at, girl? Where you at? Hey, girl, how you doing? You know what I'm saying? Hey, make sure you guys like, share, follow. Hey, share this and smash that like button and make sure you guys follow, okay? Because we're going to be doing these questions. I got a good amount today. So I'm going to wait for a bunch of people to come up in here before we get started. I want to try to have, as max participation because some people are going to be like, oh my God, I wasn't here. So you're, what is it? Houston, ADN, third semester. Shout out to you. How many semesters total? Is it 5? 5 semesters total? 5 semesters. Okay. All right. Appreciate everybody that's jumping up in here. We're 4 semesters also. You almost there. So that means what? You graduate May of next year. So congratulations to you. You will soon embark on being part of the greatest shit show on earth as nursing. You know what I'm saying? So, hey, but waiting for a couple of people to come up in here. Like I say, you guys make sure you guys share, make sure you guys follow, make sure you guys like. I'll give it about 5 minutes, but I want to know who you are, where you're from, where you're at in your nursing journey. Do you have any questions specifically? So about anything before we get started, we just say, oh, thanks. I hope so. No, there is no hope. It either is or it is not. You will be a part of the greatest shit show on earth. All right. So, yeah, that is how we talk. We speak things into existence here and it shall be so. Yeah, I got you. All right. I'm from Puerto Rico waiting for my authorization to test. Shout out to you, Jen. I actually coached a girl from Puerto Rico, probably about a year or two ago. And she went to Florida and she passed her NCLEX too. So shout out to y'all because I know y'all be working down there. All right. Got 18 people up in here. Welcome. Hey, if you guys are just joining, my name is Kevin. We're going to be doing NCLEX questions. I'm just waiting for a good amount of people to jump up in here. So, hey, make sure you guys smash that like button. Make sure you guys share it. We're going to be sitting on here for probably about little around an hour, maybe a little bit more. Really all just depends on y'all. So, like I said, make sure y'all smash the, hey, the more likes that I get, the more questions y'all get. I'm just saying, you can't be selfish. You see what I'm saying? You can't be selfish your whole life. So, hey, but who are you? Where are you from? Where you at in your nursing journey? All right. Oh, man, we got like about 84, 88 people up in here. Okay. Hey, once we hit 100, hey, we Gucci around here. Got 93. All right, cool. All right. Make sure you guys like. Hey, there it is. We got 105 people that are in here. Hey, if you guys are new, my name is Kevin. Go by the Boot Nurse. Make sure you guys follow me on all those social media platforms as well. We're going to be going over NCLEX questions. I want to know who you are, where you're from, where you're at in your nursing journey. Are you a brand new nurse? You taking the NCLEX? You work somewhere, hating life? You know what I'm saying? So let me know down in the comments. 30 years in a senior year. Shout out to you. All right. Wisconsin ADN program. Graduated BSN in December. Just accepted first nursing job yesterday. That's what I'm talking about. Mariah. Okay. I see you. All right, cool. All right. Hey, so without further ado, I know nobody else wants to hear me run my mouth. Avery, the queen of questions, is here, y'all. If y'all got any questions, just Avery got all the answers. I'm just letting y'all know, okay? Don't be nervous. That exam is not going to change at all whatsoever. So I'm just letting you know. You got to be prepared for it. Don't let an exam beat you. All right, full-time LVN student. What does it say? Hey, just wanted to say that your lives helped me pass on Monday. Andrea, hey, shout out to you, ma'am. Hey, since you passed your NCLEX, hey, send me a DM. Send me a DM telling me your story about how you passed NCLEX, or just tell me that you passed NCLEX. But everybody right now, give Andrea all the love, all the flowers right now. Tell her congratulations. Welcome her to the shit show, all that good jazz. So shout out to her. Okay, I'm back. I'm 8 weeks from nursing school. Shout out to you, AJ. I got a 1035 on my first essay. Look at you, smarty pants. That's what I'm talking about. Let's see what I know. Today's my first day in clinicals. All right, well, let's see what you know. Hey, so we're here doing NCLEX questions. My name is Kevin. Hey, make sure you guys participate. All that good jazz. Hey, give me all them likes. Give me all them likes. Hey, give them to me. Hey, don't troll my chat. You troll my chat, I'm going to ban you. I got all these questions from nurselabs.com. They actually updated their questions. You're looking for an NCLEX course. $48 7-day NCLEX course. Check that link out on my bio. Also, check out thebootnurse.com as well. If this live helped you in any kind of way conquer your NCLEX, DM me. DM me. Stop playing games. Stop being selfish your whole life. All right, here we go. Here we go. I lied. All right, here we go. Let me back this up a little bit. Everybody can see that? I think everybody can see that for the most part. If you can't see that, let me know. Amber said, let's go. Here we go. I got a damn mental health test tomorrow. That's all good, girl. That's all good. All right, here we go. Here we go. The nurse is aware that the following terms used to describe reduced cardiac output and perfusion impairment due to ineffective pumping of the heart is anaphylactic shock, cardiogenic shock, distributive shock, or myocardial infarction. For real, let's do this. Let's do it. Let's do it. All right, hey, let's see. All right, we got D's. We got B's. Okay, okay. All right. All right. So remember those key words that are in there, right? So what is our topic? What is our topic? The topic is what term is used to describe reduced cardiac output and perfusion? What is it? Which one of these ailments? I'll give you guys another 15 seconds. I forgot to start my timer. Shout out to Jason. I see you out there. Hey, make sure you guys like, share, smash that like button if you guys are new here. Make sure you guys share. Make sure you guys follow. Those are some of the most important things. And yeah, make sure you smash that like button. All right, here we go. Here we go. All right, I think we got it. Here's our answer. Here's our answer. My favorite word, infarction. Yeah, you did say that. Here we go in 3, 2. Oh my goodness, bro. Here we go. And the answer is cardiogenic shock. Hold on a second. I think that's too much. There we go. I think everybody can see that. Oh yeah. So the answer is cardiogenic shock. Cardiogenic shock is the shock related to ineffective pumping of the heart. Also, when you guys are reading your question, make sure you read the rationales on why they're correct, but also read the rationales for the answers when they're incorrect. All right. So shout out to y'all. Let's do it. Go you. Shout out to you, Monica. Okay, I see you. All right. Question number 2. Question number 2. A client with hypertension asked the nurse which factors can cause blood pressure to drop to normal levels. Is it kidney excretion of sodium only, retention of sodium in water, excretion of sodium in water, or retention of sodium and excretion of water? All right. I'm in school for my BSN. Shout out to you, Monica. Shout out to you. Everybody's saying C. All right. What else we got? Joanna and Avery say C. Hey, those are the answers, y'all. Don't even answer no more. No, I'm just playing. Keep answering. All right, I'm going to give y'all about 10 more seconds because of RAS system. There you go. Little shout out to you. Who is it? It's the Caribbean Bay. I see you. Hey, if you guys are new here, make sure you guys like, share, smash that like button. We're doing NCLEX questions. All right, here's our answer. Here's our answer in 3, 2. And the answer is C. Kidneys excretion of sodium and water. The kidneys' response to rise in blood pressure by excreting sodium and excess water. This response ultimately affects systolic blood pressure by regulating blood volume. So shout out to y'all. Yes, sir. Oh, not Cass. Cass, where you been? You been hiding? Appreciate the follow, Mimi. Kindness. User 63. Appreciate you. Appreciate the follow. All right, here we go. On to number 3. Smashing it. That's what I'm talking about. Here we go. Question number 3. Nurse Rose is aware that the statement that best explains why furosemide is administered for hypertension is it dilates peripheral blood vessels. It decreases sympathetic cardio acceleration. It inhibits the angiotensin converting enzymes. It inhibits the reabsorption of sodium and water in the loop of Henle. D. Okay, I see you. D. I think everybody's getting it right. Everybody, y'all smart out here. That's what I'm talking about. Y'all smart out here. Okay. All right. I don't even know. Somebody gave me the fingers like this. Like that ain't even an answer. Loop diuretics. Where do you see loop diuretics? We know what it is. I got you. Grace, appreciate the follow. Diuretics, D. Okay. All right. So many people on Lasix. Yeah, there are so many people on Lasix. All right, here we go. Here's our answer, y'all. Here's our answer in 3, 2. The answer is D. It inhibits the reabsorption of sodium and water in the loop of Henle. Furosemide is a loop diuretic that inhibits sodium and water reabsorption in the loop of Henle, thereby causing a decrease in blood pressure. So shout out to y'all for being a bunch of smarty pantses out here. So yeah, appreciate it. Who is it? Karen's like, it's not a potassium sparing. No, it's not. That's exactly what it is not. You are correct. All right, here we go. Question number 4. I've had like 2 to 3 clinical shifts per week and class is almost finished. All right, Cass, hey, I'll let it go. I'll let it go this time. All right, here we go. Question number 4. Nurse Nikki knows that laboratory results support the diagnosis of systemic lupus is elevated serum, was it complement levels? Thrombocytosis, elevated, is it sedimentation rates? Is it pancytoemia? Blech. Elevated anti-nuclear antibody titer, or is it leukocytosis, elevated blood urea nitrogen and creatinine levels? D question mark? D question mark? Okay. Cass says D. Is it Genevieve? Is it Genevieve or Genevieve? All right, cool. All right, we got some C's. Okay, we got some C's out there. We got some D's. No A's, no B's, huh? Okay, so y'all just, okay, so you just want to be different. Whatever. Let me give y'all about 5 more seconds. You will be A&A positive. Okay. Kat, appreciate the follow. Hey, if you guys are new here, make sure you guys like, share, smash that like button, share, and follow. I need it all. Give them to me. All right, here we go. In 3, 2, and the answer is C. Talking about that A&A titer. Laboratory findings for clients with SLE usually show pancytoemia, elevated A&A titer, and decreased serum complement levels. Yes, that's what I'm talking about. A&A is for lupus. Shout out to you, Sarah. I'm sorry, Nurse Sarah. You know, gotta put some respect on your name. You know what I'm saying? Surprised you got it right. Hey, ain't nothing wrong with guessing. Here we go. On to the next one. Question number 5. Everybody can see that, right? I think everybody can see that. That should be good. All right. We smart together until one of us is in front of a computer. Yeah, that's usually how it goes. All right, here we go. Question number 5. Arnold, a 19-year-old client with a mild concussion is discharged from the emergency department. Before discharge, he complains of a headache. When offered acetaminophen, his mother tells the nurse that his headache is severe and she would like her son to have something stronger. Which of the following responses by the nurse is appropriate? Your son has a mild headache. Acetaminophen is strong enough. Aspirin is avoided because of the dangers of Ray's syndrome in children or young adults. Narcotics are avoided after a head injury because they may hide a worsening condition, or stronger medications may lead to vomiting, which increases the intracranial pressure. You got C. Somebody said D. Okay. All right, cool. All right, C, we never give narcs after a head injury. Look at that. Okay. Appreciate the shares. Hey, if you're new here, make sure you guys smash that like button, share, and you guys follow. We do these, 3 times a week, Monday, Wednesday, Friday at 5:30. Not sharp because I think I was a little late today. So, but y'all good out here. Appreciate the follow, Bailey. Appreciate the follow, Tanya. Appreciate the follow. All right, hey, y'all, here's our answer. All right, here we go. In 3, 2, and the answer is C. Narcotics are avoided after a head injury because they may hide a worsening condition. So whoever said that, y'all are right. That's what I'm talking about. You were tired of you. Yeah, look, I'm trying to tell you. Narcotics may mask changes in the level of consciousness that indicate increased intracranial pressure. And that is 100% correct. Shout out, Yanni. Thank you for the heart, girl. You know what I'm saying? I appreciate you. All right, cool. Then let me make sure we back this up because I know this is kind of hard for y'all to see. So that should be good. All right, here we go. On to the next one. All right, hey, so a little quick break. We're doing NCLEX questions. Make sure you guys participate. Give me all them likes. I want them all. Don't troll my chat. I got these questions off nurselabs.com. If you need an NCLEX course in its pre-launch phase, $48 to 7-day NCLEX course. Check that link in my bio. Also, check out thebootnurse.com. Also, if you pass the NCLEX, DM me and stop playing games. Let's go. All right, here we go. Question number 6. Yeah, we just started. When evaluating an arterial blood gas from a male client with a subdural hematoma, the nurse notes the PaCO2 is 30 millimeters of mercury. There you go. Which of the following responses best describes this result? Appropriate. Lower CO2 reduces intracranial pressure. Emergent. The client is poorly oxygenated. Is it normal or is it significant? And the client has alveolar hypoventilation. I passed the NCLEX 13 years ago. Sarah, thank you. Go to my DMs, girl, and tell me. I said if you just passed the NCLEX. Come on now. Come on. Appreciate the follow, Cammie. Mason, appreciate the follow. All right, what are we thinking? What's our answers? I got some C's out there. Throw some D's out there. I only got one answer. What's up with that? Come on, y'all. Give me some answers. Whoops. Okay. Got A. Got some C's. Got some D's. Some C's. Okay. Give me them answers. Give me them answers. What did you say, Avery? Avery said something. B30 is alkaloid. Okay. Okay. I see you. I don't know what CO2 is. Well, you better. Hey, arterial blood gases is part of when you studying for NCLEX. I'm telling you right now, you better know it. Better know what those are. Metabolic acidosis, alkalosis, respiratory acidosis, alkalosis, compensated, uncompensated. You got to know what they are. All right, here we go. Here we go. Here's our answer in 3, 2. And the answer is A. Appropriate. Lower CO2 reduces intracranial pressure. A normal PaCO2 value is 35 to 45 millimeters of mercury. CO2 has vasodilating properties. Therefore, lowering PaCO2 through hyperventilation will lower intracranial pressure caused by dilated cerebral vessels. Why is it that everybody and their mom wants to call me while I'm doing a TikTok live? It's weird. Weird. Respiratory acidosis. Look at you. Shout out to my professor. It's always ICP, right? Look at you. Alkalosis. There you go. All right, here we go. On to the next one. All right, here we go. Question number 7. When prioritizing care, which of the following clients should the nurse, Olivia, assess first? So this is a priority question. Hey, when it comes to seeing a patient, which patient should you see first? Who's gonna die if I don't see them first? Think about it like that, okay? A 17-year-old, 24 hours post-appendectomy, a 33-year-old with a recent diagnosis of Guillain-Barré syndrome, 50-year-old 3 days post-myocardial infarction, or a 50-year-old with diverticulitis. Okay, we got some people that said A, we got some B's, we got some A's, we got some B's. Tell me why. As a matter of fact, with your answers, tell me your answers and then tell me why you think that answer is. Appreciate the follow. Thank you. Hey, if you guys are new here, make sure you guys smash that like button, like kill it. What's a client? A client, you're like a person. Kind of like, when you go to a barbershop or you'll get your hair done or your nails, they don't call you a person, they call you a client. So that's what they are. You're a client. 24-hour post-op. Okay. Urgent over chronic. So stable versus unstable, chronic versus acute, right? So which one of these would be, what verbiage in here would give you that idea of what is acute and what is not? And then you also have to think about what are the ailments that they have. Somebody who had an appendectomy. What is Guillain-Barré syndrome? What is a myocardial infarction and what is diverticulitis? C is a heart issue. Oh, you're asking. I don't know if you were asking or not. I'm sorry. B, airway would be paralyzed. Okay. The recent. Okay. Guillain ICU. Shout out to y'all. Here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is B, a 33-year-old who was, I don't know what happened. Hey, where y'all at? Y'all still there? Man, y'all better still be here. All right, here we go. All right, cool. All right, I don't know what happened, y'all. I don't know what happened. I appreciate y'all still being up in here. Here, you know what? I'm just gonna go to the next one because I just explained it. You know what I'm saying? Hey, if y'all can see that, give me a thumbs up. Yeah, we back. I don't know what's going on. Hey, I got good interwebs out here, so I don't know what the problem is. You know what I'm saying? So, all right, cool. Here we go. Here we go. All right, here we go. Question number 8. Question number 8. JP has been diagnosed with gout and wants to know why cholecystine is used in the treatment of gout. Which of the following actions of cholecystines explains why it's effective for gout? Replaces estrogen, decreases infection, decreases inflammation, decreases bone demineralization. Which one we got? Which one we looking at? Hey, shout out to everybody who's just now joined. We're doing NCLEX questions. I appreciate you guys' patience. I don't know what the hell happened to my phone. And my internet. So my dad has gout. So since your dad has gout, Haven, you got the answer? God, come on now. Come on. Thumbs up. Okay. All right. Don't study the night before. Look over notes. You're done. Get rest. Facts. I don't know who said whatever they said, but if you're taking the NCLEX tomorrow, get off this live. Go home. Cold chais. Look, I don't know how to pronounce stuff, so I'm just gonna figure it out like my son does. All right, here we go, y'all. Here we go. Here we go. Here we go in 3, 2. Oh, and the answer is C, decrease inflammation. Yeah, so it decreases inflammation by reducing the migration of leukocytes to synovial fluid. All right, so shout out to everybody that picked C. Shout out to all y'all. And Monica, appreciate the follow. Appreciate all 270 plus of y'all in here rocking with us. Y'all make sure y'all participate. Smash that, kill that like button, and make sure you guys share and follow. All right, here we go. Question number 9. Norma asked for information about osteoarthritis. Which of the following statement about osteoarthritis is correct? It's rarely debilitating. It's a rare form of arthritis. It's a common form of arthritis, or it only affects people over the age of 60. D. Okay, AJ, you ain't got to scream at me. I see you. Hey, welcome. If you guys are new, we're doing NCLEX questions. We're on question 9 of I don't know how many. Make sure you guys like, share, smash that like button. I want to know who you are, where you're from, where you're at in your nursing journey. If you pass NCLEX and these lives help you, make sure you guys DM me. Send me a good old DM. Change seed. Sabrina, look, you already know how I feel about changing answers. Well, if you don't know, you know now. 9 times out of 10, your first answer is the correct answer. All right, here we go. Here's our answer in 3, 2, and the answer is C. Okay, all right, I see you. I'm not a nurse, just a but I'm a dietitian. This is so helpful. Knowledge gap. Shout out to user 95, okay, or 97. Shout out to you. It's okay. I get all kinds of folks over here: RTs, PTs, doctors, electrical engineers. Whatever the fuck. So you're good out here. You're a surge tech. Cool. So am I. Osteoarthritis is the most common form of arthritis and can be extremely debilitating. It can afflict people of any age, although most are elderly. All right. CST. Shout out to all my surge techs. Hey, I used to be a surge tech. I'm still a surge tech in the Navy. I was a surge tech instructor for about 3.5 years. So look, I know it all. I know it all about y'all. I'm Gucci out here. All right, here we go. Question number 10. Veterinary. I got a vet tech here. Yo, surge tech in the Navy. Yeah, I'm a surge tech in the Navy. All right, here we go. Question number 10. Ruby is receiving thyroid replacement therapy, develops the flu, and forgets to take her thyroid replacement medication. Okay. The nurse understands that skipping this medication will put the client at risk for developing which of the following life-threatening complications? Is it exophthalmos, whatever, thyroid storm, myxedema coma, or tibial myxedema? Which one? What we got? B, not A. That's an I and D. Okay. Was it what did you say? Kyptoplasty, something like that. Priya, I don't know what you said. Keep going, y'all. Keep going. What we got? We got C. Somebody say myxedema coma. All right. Okay. Somebody saying C. So we're pretty much stuck between C and B. So answer this question to yourself. Is a thyroid medication, thyroid replacement therapy, or a medication that's being given, who is it given to? Who is it given to? So we're talking about thyroid, so who is it given to? Somebody who has hypo or hyperthyroidism. Okay, so somebody's telling me hypothyroidism. Okay, so what are the signs and symptoms of somebody who has hypothyroidism? Right? And if I skip it, what would be the result of me skipping it? From placement, I had a thyroidectomy. Oh, look at that. Okay. There you go. Okay. All right. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is C, a myxedema coma. It's severe hypothyroidism is a life-threatening condition that may develop in thyroid replacement. Thyroid replacement medication isn't taken, right? So a lot of people pick B. So what is B for? So if myxedema coma is for hypothyroidism, then thyroid storm would be for hyperthyroidism. I can tell you right now, those are two of the biggest one of the biggest things that you would need to know in regards to, separating them when you're studying for NCLEX, okay? Hey, so I know we were done with that. I'm going to skip this one. Participate. Make sure you guys smash those likes. Don't troll my chat. I got these questions off nurselabs.com. NCLEX course, if you're looking to get one, $48. Check it out in the link in the bio. Also, check out thebootnurse.com. And if you pass your NCLEX because of my live and recently because of me, go and DM me. All right, here we go. What the question be? Wait, what? Aiden, I don't understand what you're saying. Question number 11. Nurse Sugar, first of all, you know what? Never mind. Nurse Sugar is assessing a client with Cushing syndrome. Which observation should the nurse report to the physician immediately? Is it pitting edema on the legs, an irregular apical pulse, dry mucous membranes, or frequent urination? A, B, A, B. Okay. Hey, so what are the signs and symptoms of somebody who has Cushing's syndrome? Think about that. Who knows a really good way? Who knows a really good way to remember Cushing's syndrome? Too much cortisol. Okay. Thank you. Is this Somer? Thank you for the follow. I'm gonna give you guys about another 20 seconds. Steroid. Okay. Your dog. What the hell? Large round belly, skinny legs. Okay. Squishy. Moon face. Okay. There we go. Appreciate the follow, y'all. Hirsutism. Okay. All right. Hey, so here's a really good one. Everybody should go Google if you haven't seen it. But Google Cushman. And if you Google Cushman, like Cush space MAN, you'll see somebody who drew somebody with a moon face, with a big old belly, with striate, a muscular atrophy, all those good ones. All right. So go look at Cushman and once you understand what that drawing is, you'll never forget it. But here's our answer. In 3, 2, Pillsbury Doughboy. Really, Haven? Lord have mercy. All right. So the answer is B, an irregular apical pulse. Because Cushing's syndrome causes aldosterone overproduction, which increases urinary potassium loss, the disorder may lead to hypokalemia. Therefore, the nurse should report signs and symptoms of hypokalemia, such as an irregular apical pulse, to the physician. Right? There you go. There y'all go. Appreciate the follow. Hey, if you guys are new here, make sure you guys smash that like button. Make sure you guys share and you guys follow. All right. And we're doing NCLEX questions. I want to know who you are, where you're from, where you're at in your nursing journey. I want to know all that stuff. Pre-nursing student. Are you a nursing student? You graduated? You take the NCLEX? Did you fail it? Have you been a nurse for a long time and you're disgruntled and you hate life? No, I'm just playing. But yeah, I want to know all that. Literally a senior in high school. Haven, you're a senior in high school? Lord of mercy. All right, here we go. Question number 12. Is it Cyril? Cyril with severe head trauma sustained in a car accident is admitted to the intensive care unit. 36 hours later, the client's urine output suddenly raises above 200 an hour, leading the nurse to suspect diabetes insipidus. Which laboratory finding supports the nurse's suspicion of DI? Is it above normal urine and serum osmolality levels? Is it below normal urine and serum osmolality levels? Above normal urine osmolality levels, but below normal serum osmolality levels? Or is it below normal urine osmolality levels and above normal serum osmolality level? That's a lot of osmolality, okay? All right, there's a lot of that. Who said thank you? What happened? What I miss? Okay, all right. Somebody said I'm a flight paramedic. Shout out to you. Yes, that's what I'm talking about. All right, cool. Let's see. We got B's, we got C's, we got B's, we got C's, we got D's. Okay. Appreciate you. Cass said C, y'all, so it's already over. Sabrina said C, it's already over. PA student here. This is so helpful. Shout out to all my PAs out there. Shout out to all my RTs, my physical therapists, my physical therapy techs. Had some dietitians out there. Shout out to y'all. Hey, but mostly, and this is no shade, mostly shout out to my LPNs. You know, I love my LPNs. Shout out to my techs out there. I love y'all. We Gucci out here. I love y'all. I don't care what no motherfucker tell y'all. Like, because y'all are important. Every single one of y'all. All right, here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is D. In diabetes insipidus, excessive polyuria causes diluted urine, resulting in below normal urine osmolality level. At the same time, polyuria depletes the body of water, causing dehydration that leads to an above normal urine osmolality level. I'm in high school and I want to go into the medical field. This is dope. Shout out to you, sir. Shout out to you. How come is D? I just read it. I literally just read it. Here's the rationale right here. Remember, when you study, always read your rationale. Always. How did y'all miss that? Hey, who said that? Sugary tomato? First of all, your fucking name is Sugary Tomato. Why? I'm just playing. But you got to think is like some people are at different levels in their nursing studies. Some people are not even in nursing school or not even nurses. All right. So they're going to miss it. All right. No one's going to be perfect. All right. Here we go. Here's question number 13. Is it Jamari is diagnosed with hyperosmolar hyperglycemic non-ketotic syndrome, or HHNK. Is stabilized and prepared for discharge. When preparing the client for discharge in home management, which of the following statements indicates that the client understands her condition and how to control it? So what statement did this patient say that is correct? All All right. Is that I can avoid getting sick by not becoming dehydrated and by paying attention to my need to urinate, drink, or eat more than usual. Or is it B, if I experience trembling, weakness, and headache, I should drink a glass of soda that contains sugar. I will have to monitor my blood glucose levels closely and notify the physician if it is consistently elevating. Or is it D, if I begin to feel especially hungry and thirsty, I'll eat a snack high in carbohydrates. It's C. Okay. Is it Lindsay? Thank you for the follow. Appreciate you. Hey, if you guys are just joining, we are doing NCLEX questions. Make sure you guys like, share, smash that like button, and follow and share, right? I need all the love. I need all them likes. Make sure you guys do it. All right. I want to know who you are, where you're from, and where you're at in your nursing journey. Justin, appreciate the follow. I'm going to give you guys 5 more seconds. No, I will give 10 more seconds. New to this, and you are terrific. Marilyn, I appreciate you. I appreciate you being here. I think real life is E. What are you talking about? There is no E on here. But remember, it's not saying it's not about real life, but it's about what the test presents to you. Remember? So here we go. Here's our answer in 3, 2, and the answer is A. I can avoid getting sick by not becoming dehydrated and by paying attention to my need to urinate, drink, or eat more than usual. Inadequate fluid intake during hyperglycemic episodes often leads to HHNK. By recognizing the signs of hyperglycemia, such as polyuria, polydipsia, and polyphagia, and increasing fluid intake, the client may prevent HHNK. All right. Hey, so what's another one that's like HHNK? What's another ailment that's like HHNK? There it is. Kareen said it. DKA. There it is. So if you remember what the signs and symptoms that you're looking for, IDKA. Really? So if you remember what the signs and symptoms are for DKA, you will be able to understand what they are for HHNS. Correct. Yeah, like type 2. All right, here we go. Because you're looking at an elevated high glucose, right? Hyperglycemic, right? So here we go. All right, appreciate that answer. Appreciate y'all. Y'all are Gucci out here. Make sure y'all smash that like button. Man, hopefully y'all didn't just see that answer, but I'm going to do it anyway. The 3 Ps, right? Appreciate all the follows. All right, question number 14. A 66-year-old client has been complaining of sleeping more, increased urination, anorexia, weakness, irritability, depression, and bone pain that interferes with her going outdoors. Based on these assessment findings, the nurse would suspect which of the following disorders. Is it diabetes mellitus, diabetes insipidus, hypoparathyroidism, or hyperparathyroidism? Labella Luna says A. Is it Michaela? Michaela says, Michaela, I can't see what you said. It's gone now. Hey, if you guys are new here, we're doing NCLEX questions. Make sure you guys smash that like button. You guys share and you guys follow because, I'm kind of cool sometimes. It's kind of cool. A little bit about me. Been a nurse for 3.5 years. I have ICU experience, working ICU for a year. Then a little bit of PACU, and then I now currently work in the operating room. So in the short 3 years, I've been to multiple different spots. Be a jack of all trades if you can. All right, here we go. I think we're good. Overactive parathyroid hormone. Shout out to you. Look, you're an RNA. You can't answer. No, I'm just playing. You're good. Here we go. In 3, 2, and the answer is D. Hyperparathyroidism is the most common in older women and is characterized by bone pain and weakness from excessive parathyroid hormone. Clients also exhibit calciuria causing polyuria. There we go. Yes, was right. Shout out to y'all. Is it Kyra and Lena? Appreciate the follow. Thank you. Appreciate the follow. Thank you. All right, here we go. On to the next one. Yeah, thyroid cancer. Oh, that is terrible. All right, here we go. Question number 15. Is it Nurse Lords is teaching a client recovering from Addisonian's crisis or Addison's disease about the need to take is it flu? Oh my God, whatever, bro. Y'all can read that. And hydrocortisone at home. Which statement by the client indicates an understanding of this instruction? I'll take my hydrocortisone in the late afternoon after dinner. I'll take all of my hydrocortisone in the morning right after I wake up. I'll take 2/3 of the dose when I wake up and 1/3 in the late afternoon, or I'll take the entire dose at bedtime. What do we got? Got D, question mark. D. Katrina says C. Okay. Amy, appreciate the share. Dr. Z, I teach nursing students. Is Dr. Z who? Like, is like the Dr. Z from like NCLEX High Yield? That's the only Dr. Z that I know. B, okay. All right. It affects sleep and wake up cycle. Okay. All right. Got C, got B. Was it K Brown? Appreciate the follow. All right, y'all. Here's our answer. Here is y'all's answer in 3, 2. And the answer is C. I'll take 2/3 of the dose when I wake up and 1/3 in the late afternoon. Hydrocortisone, a glucocorticoid, should be administered according to a schedule that closely reflects the body's own secretion of this hormone. Therefore, 2/3 of the dose of hydrocortisone should be taken in the morning and 1/3 in the late afternoon. This dosage schedule reduces adverse effects. So there's your answer, y'all. There's the answer. Is it Aman? Appreciate the follow. Thank you. All right, here we go. On to the next one. Hey, real quick break. Hey, so we're doing NCLEX questions. Make sure you guys keep participating. Don't troll my chat. Give me all of them likes. Nurselabs.com is where I got these questions. Y'all know I don't gatekeep. They actually just updated their questions. Check out the 7-day NCLEX course. That link is in my bio. It's going for $48. Also check out thebootnurse.com. And if this live or these lives that I've been doing have been super helpful, and then you passed your NCLEX off of it, hey, DM me and let me know. All right. Here we go. Question number 16. And just like that, I think I lost like 50 people. People are just like, oh, I don't like this fool talking about his own shit. All right, here we go. Which of the following laboratory test results would suggest to the nurse Lynn that a client has a corticotropin secreting pituitary angioma? High corticotropin and low cortisol levels. B, low corticotropin and high cortisol levels. Is it C, high corticotropin and high cortisol levels, or D, low corticotropin and low cortisol levels? A, B. Sarah follows. All right, here we go. Got A. I'm going to say B. That's cool. Cushing's disease. Okay. Asante. Is it Asante? Who said that? Asante says B. Okay. I think that's what you said, unless I'm dyslexic and I didn't read it right. All right. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Okay, I said it right. Sweet. I want to know who you are, where you're from, where you're at in your nursing journey. All right. My name's Kevin, and you're hanging out with another 200 plus people trying to do the same thing, answer questions. All right, here we go. Here's our answer, y'all. Here's our answer in 3, 2. ATL, Atlanta. Shout out to you. All right, here we go. The answer is C, high corticotropin and high cortisol levels. A corticotropin secreting pituitary tumor would cause high corticotropin and high cortisol levels. I'm from DC, first year nursing student. Shout out to you. Sarah says, woohoo. Anita, okay. I'm a pre-nursing student. Shout out to you, Kyra. Is it Kyra or Kira? If it's Kyra, give me 1. If it's Kira, give me 2. Taking NCLEX tomorrow. Muhammad, I'm going to need for you to go away. Hey, if you don't know it by now, sir or ma'am, or whatever you identify as, you do not know it at all. Oh, okay. Got you. So it's Kyra. Got you. Like Kyra LaPlatte. Is it Kyra LaPlatte? Kyra Platte? Y'all know what I'm talking about. Obviously, I don't know how to talk. You failed twice, Katie. I'm sorry to hear that. What are you going to do to fix it? First year BSN. Okay. Shout out to y'all. All right, here we go. Surge tech. Hey, shout out to all my surge tech that are out there. Nurse practitioner now, but don't remember all the stuff. Amy, that's okay. Hey, remember, just because you're a nurse doesn't mean that you need to know everything. You're not perfect. Sometimes it's not in your realm anymore. Muhammad, I'm just saying, hey, go out there, do great, and then on Friday, come back and let us know. What did that say? Do you have any advice for studying for my second attempt? You need to get your breakdown, and you need to see where you didn't do well on. Somebody said UWorld. I wouldn't necessarily say go straight to UWorld because UWorld may not work for everybody. I use it. Didn't work well for me at the time. So it all just depends on who you are. A male client is scheduled for a transsphenoidal hypophysectomy to remove a pituitary tumor. Preoperatively, the nurse should assess for potential complications by doing which of the following: testing for ketones in the urine, testing urine-specific gravity, checking temperature every 4 hours, or performing capillary glucose testing every 4 hours. Flight nurse here, UWorld did not work for me. I'm just saying, UWorld didn't work for me either. UWorld didn't work for me. Hearst didn't work for me. I love Mark Klimick. I used Kaplan. That's what helped me pass. So it all just depends. The thing about it is just like, if you're going to suggest something to somebody, if you're going to suggest something, you really have to come with like a convincing way on like, hey, like this is why it works, but it may not work for you. Art, so see like right here, is it me says Archer was amazing. And then you go to Priya and she said it didn't work for her. That's Archer, you know? So it all just depends. All just depends on you. I don't shit on reviews unless they're really shitty reviews. I'm just saying. Archer gives readiness assessments. A lot of places give readiness assessments. So, all right, here we go. Here's our answer, y'all. Here's our answer in 3, 2. The answer is D. Perform capillary glucose testing every 4 hours. The nurse should perform capillary glucose testing every 4 hours because excessive cortisol may cause insulin resistance, placing the client at risk for hyperglycemia. Yes. Shout out to y'all. Shout out to all y'all that got that answer right. Hey, remember, so if you didn't pick the right answer, always read your rationale on why this answer is correct for this specific question. But then go down to the ones on why they're incorrect to see why they are incorrect. Okay? I haven't even gone to nursing school program yet and I'm doing well. That's okay. But that's what you want. You want to be this way. You want to do well. I was getting high on my Archer readiness assessment and still failed. UWorld. I'm not even gonna lie to you. I got really high on my assessments on UWorld too when I first took my exam and I failed. And I got really high on the second time and I failed the second time. So UWorld just didn't work for me. I didn't know what I was missing, and then I found out what I was missing. So here we go. Question number 18. Capillary glucose monitoring is performed every 4 hours for a client diagnosed with diabetic ketoacidosis. All right, now paint the picture. What are they going to look like, right? Insulin is administered, right, using a scale of regular insulin occluding to the glucose results. At 2 p.m., the client has a capillary glucose level of 250, for which he receives 8 units of regular insulin. Nurse Mariner should expect the dosage onset to be 2 p.m. and its peak to be 3 p.m. The onset to be 2:15 and the peak to be 3. The onset to be 2:30 and the peak at 4. Or the onset to be 4 and the peak at 6. So think about regular insulin, right? Is regular insulin, is it ultra fast? Is it fast? Is it, intermediate? Is it, slow acting? So think about that. And once you figure out which insulin is what, you will know what the onset, the peak, and the durations. All right. And this is part of endocrinology, which is huge on NCLEX. On top of, it's huge as working as a nurse, especially if you're working on the floor. You can kill somebody so fast by giving them too much insulin. Play around if you want to. I've seen people do it. Hell, there's stories out there where people are ODing people on insulin and people are dying because they're just like, I was making it easier for them. Don't be that guy or gal. All right. All right. Hey, if you guys are new here, appreciate you. Hello. Oh, hey, what's up? User 57. I see you out there. Hey, if you guys are new here, welcome. Make sure you guys share, smash that like button, and you guys follow. We're doing NCLEX questions. I want to know who you are, where you're from, and where you're at in your nursing journey. Not just me, but everybody does. Appreciate the follow. Appreciate the follow. There is our answer. It is C. Onset to be 2:30 and the peak to be at 4. Regular insulin, which is a short-acting insulin, has an onset of 15 to 30 minutes and a peak of 2 to 4 hours. Because the nurse gave the insulin at 2, the expected onset would be from 2:15 to 2:30, and the peak would be from 4 to 6. All right, so shout out to y'all. Everybody shout out to the PCA. Patient care tech, shout out to y'all. Shout out to y'all. I got my associates in California. I had to move to Florida, and so I was looking for a program. Nice. I love this. Cool. You're welcome. You're welcome. You're welcome. On to the next one. All right, here we go. Question number 19. The physician orders laboratory tests to confirm hyperthyroidism in a female client with classic signs and symptoms of this disorder. Which test result would confirm the diagnosis? Is it A, no increase in the thyroid stimulating hormone level after 30 minutes during the TSH stimulation test? Is it B, a decreased TSH level? Is it C, an increase in the TSH level after 30 minutes during the TSH stimulation test? Or is it D, below normal levels of serum T3 and serum T4 as detected by radio immunoassays? Let me not do what I was about to do. The ADHD was about to kick in super hard with that one. All right, we got B's, we got D's, and we got C's. Shout out to all 280 plus of y'all up in here. If you guys are new here, welcome, welcome. Make sure you guys smash that like button. Make sure you guys share, and make sure you guys follow. My name is Kevin. Been a nurse for about 3.5 years. I have ICU, OR, and PACU experience. I've been in the Navy for 16 years, if anybody ever really cared about that. So if you're new here, that's a little bit about me. So you already know how we do. Love this. How often do you do these lives? I do the lives every Monday, Wednesday, Friday at 5:30 Central Standard Time, Texas time, because that's the only time that matters. All right, here's, I'm just playing. Here's our answer. And the answer is A. Were you a nurse in the Navy? No, I was search tech in the Navy. The answer is A. No increase in the TSH levels after 30 minutes during the TSH stimulation test. In the TSH test, failure of the TSH level to rise after 30 minutes confirms hyperthyroidism. Who said that? Thank you for your service. Oh, thank you for your support. That's always appreciated. My husband's about to hit 20 years in. Look, I'm trying to tell you, these last years are tough, yo. They're tough because I ain't even trying to do them. I just want to leave. All right. Shout out to everybody getting this answer right. Make sure you guys like, share, follow. Did you see active duty? Where were you? Yeah, I was active duty for 14 years. And I've been to a lot of places. Question number 20. Rico, Uncle Rico, with diabetes mellitus, must learn how to self-administer insulin. The physician has prescribed 10 units of U100 regular insulin and 30 units of isophane insulin suppression, right, or MPH, to be taken before breakfast. When teaching the client how to select and rotate insulin injection sites, the nurse should provide which instruction? Inject insulin into healthy tissue with large blood vessels and nerves. Rotate injection sites with the same anatomic region, not among different regions. Administer insulin into areas of scar tissue and hypertrophy whenever possible. Administer insulin into sites above muscles that you plan to exercise heavily later that day. Okay. Well, some of these we know are just incorrect, and we could just get rid of them. All right. So what do we got? What are our answers? Joanna, I'm still in. To answer your question, how many times did you take the NCLEX? I've taken the NCLEX 3 times. 3. I've taken the NCLEX 3 times, y'all. Hey, if you guys are just joining, my name is Kevin. We're doing NCLEX questions. Make sure you guys like, share, follow, smash that like button. Make sure you guys share. Don't be greedy. You don't know who's going to need it. And make sure you guys follow. But yeah, I took my NCLEX 3 times. And I am not ashamed to tell nobody that. Yeah, I passed. I've been a nurse for 3.5 years, Missy. Where you been? Nice. When do you plan on retiring? I retire in 2027. Hello, I'm a type 1 diabetic. I'm a type 1 diabetic in this B. Stephanie, that's kind of cheating, but I got you. All right, here we go. Here's our answer in 3, 2. And the answer is B. Rotate injection sites within the same anatomic region, not among different regions. The nurse should instruct the client to rotate injection sites within the same region. Rotating sites among different regions may cause excessive day-to-day variations to the blood glucose levels. Also, insulin absorbs differs from one region to the next. What did you do different when starting the 3rd time? A lot. There's a lot of things I did. As a matter of fact, I told my story on YouTube. Go check it out on why I felt in the NCLEX. Are the rules in Texas with repeat test taking? Or what are the rules with repeat test taking? 4 years. You can take it up as many times as you want with 4 years. After the 4-year time, if you haven't passed, then you have to go in front of the Board of Nursing and essentially appeal. And then they'll either grant you another chance or not. And if they don't, you have to go back to school. Thank you for not waiting 15 minutes to give the answer like other people on their lives. Well, I actually got yelled at a few times. So hold on a second. Hey, so we're doing NCLEX questions. Make sure you guys participate. The more likes you guys give, the more questions I'm going to give you. Just being all the way. Don't troll my chat. If you do, I'm going to ban that ass. I don't gatekeep. I give you the questions are from nurselabs.com. Check out the 7-day NCLEX course if you're interested on getting a jump on something like that. If you're a brand new nursing student. Also, check out thebootnurse.com. And if these lives have helped you pass recently, let me know. Send me a DM. All right, here we go. Y'all can read that. I'm looking at y'all's comments. Thank you for not waiting 15 minutes to give the correct answer like others. So Some people are just impatient, number one reason. Secondly is I got yelled at one time. They were like, hurry up. And I was just like, okay, 600. But so I try to keep it fast because I know, people got stuff to do. Just retired 2 years ago. Early retirement though. Okay, shout out to you. Nice. Can't wait to roll through retirement. That's what I'm talking about. I appreciate all the follows. Give me some answers. Do you think a repeat test taker can pass the NCLEX from studying 3 weeks before the next attempt? Anita, I don't know. It all just depends on you. I don't know why you failed. I don't know what your breakdown looks like. I don't know what your home life looks like. If you want to join the 7-day NCLEX course, the link is in my bio. Click on the link tree and you'll see it. I'm not taking the test. It is like testing your knowledge, but thank you for this. Yep, for sure. We got B's, we got D's, we got B's. Okay. The only reason it's taking me so long is because my husband's active. No, I'm tracking. I got you. I went to nursing school while I was on active duty. So trust me when I tell you, I know things are hard. So, all right, here we go. Here's our answer in 3, 2. And the answer is B, below normal serum potassium levels. A client with HHNS has an overall body deficit of potassium resulting from diuresis, right? Which occurs secondary to hyperosmolar hyperglycemic state caused by the relative insulin deficiency. It says D, also thank you, Middle of Nursing School in Hearton Farm. Definitely needed this. Shout out to you. Heavy Metal Girl, shout out to you. All right. Hey, if you guys are just now joining, we're doing NCLEX questions. Make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. I'm kind of all right. I'm kind of cool. You know what I'm saying? Kind of, whatever the kids say. I'm lit or I'm risen. Is that what the kids say? Whatever. Y'all know what I'm talking about. So the 7-day NCLEX course is a on-demand course. I don't do the live. I don't do a live course, not yet. So I'm working on just getting the course up and running, and then I'll start offering actual live courses. And if I do that, it'll be once a month. So here we go. I test in 10 weeks or 6 weeks. Okay, shout out to you. All right, here we go. Question number 22. For a client with Graves' disease, which nursing intervention promotes comfort? Restricting intake of oral fluid, placing extra blankets on the client's bed, limiting intake of high carb foods, or maintaining room temperature in the low normal range. Students learning a lot. Thank you for sure. I love doing this. all the time. What are we thinking? Hey, shout out to all 200 y'all that are in here. Hey, if you are new, we are doing NCLEX questions, for nursing students, RN or LPN, whoever you are. Shout out to my LPNs. I love y'all. Make sure you guys like, share, follow. Let me know who you are. And where you're at in your nursing journey. Let us all know. Let us interact. I'm gonna give y'all about 10 more seconds. Everybody's saying D. Okay. I'm an RN studying. Shout out to you, user 30. I got you. Jojo says D. I'm gonna go B. Okay, Danielle. I can't remember Graves. Hey, I'm gonna tell you a little trick here in a second once we get the answer. All right, here we go. In 3, 2. So monitoring room temperature maintaining room temperature in the low normal range. Graves' disease causes high signs and symptoms of hypermetabolism, such as heat intolerance, diaphoresis, excessive thirst, and appetite and weight loss. To reduce heat intolerance and diaphoresis, the nurse should keep the client's room temperature in the low normal range. So what's the other name for Graves' disease? What is the other name for Graves' disease? I will be an RN. That's what I'm talking about. You speak that into existence. It's hyperthyroidism, right? So you always hear like you run, like hyperthyroidism is you run. Everybody that has hyperthyroidism, everything is high. Heat intolerance, right? Diaphoresis, so they're high sweating. Excessive thirst, they're highly thirsty. They have an appetite, stomach growling, so it's really hyperactive. And you're so active that you're losing weight, right? So they run. They run themselves into the grave, all right? You run yourself into the grave. Now, hypothyroidism, that's different. It is the complete opposite. It's a 7-day NCLEX course, more about content and more about tests and strategy. So the 7-day NCLEX course is all about its content on top of, I'm working on videos right now, breaking down each section of the NCLEX test plan. So management of care, breaking down questions, pharmacology, breaking down questions, so on and so forth, through all 8, to include new generation type of NCLEX questions, which are still relatively the same, but they add the bow ties and all the other good jazz. And then NCLEX style questions are going to be soon around the corner. So here within the next about 3 months, 3 to 4 months, that whole course is going to be done. So, and everybody that has the course now is going to get all of that. That's one of the great things about being a pre-order person, or a what do they call it? An angel investor or whatever, one of those things. I just found you. I'm a West Coast University, just getting started. Shout out to you, Michelle. All right, here we go. Question number 23. 68 Charlie moment. Is that what I think it is? The 68 Charlie moment? Patrick is treated in the emergency department with Cole's fracture sustained during a fall. What is a Cole's fracture? You're welcome, Michelle. Shout out to all 212 of y'all. Make sure you guys like, share, follow. I want to know who you are, where you're at in your nursing journey. That was my MOS. I figured 68 something is medical. The only ones I remember is whiskeys and deltas, because the deltas are surge techs, and I used to be an instructor. L23 Alpha, shout out to you. Shout out to you. Moosney. Hey, I know that's you. Hey, L23 Alpha, 8483, whatever y'all want to call them. You know what I'm saying? So what are we thinking? A's. Okay, we got A's. All right, I'll give y'all about 15 more seconds. RN soon to be MP here. Thank you for this. Shout out to you, Rachel. I was about to call you Michelle, and I know that's not your name. But shout out to you, Rachel, on that journey to MP. What type of MP are you going to be? In my last year. Shout out to you, Amanda. JBSA was wild in 2021. Look, okay. I was there, AKEV, nursing student here, EMT, ER, Philly. We're covering endocrine now, so this is perfect. I'm glad this worked out for you. Is it Miss Armstrong? Rachel, thank you for the follow. Appreciate it. Hey, here we go, y'all. Here we go. Here's our answer. Here is our answer. And 3, 2, your number one mama. Appreciate the follow. Y'all wild out here with the names. All right, the answer is A, fracture of the distal radius. Cole's fracture is a fracture of the distal radius, such as from a fall on an outstretched hand, which is common in women. 10 more months till RN. That's what I'm talking about, Jen. That's what I'm talking about. Anna, appreciate the follow. The last sperm, thanks for the share. You're not the last sperm, because now you're out here spreading love. All right, I'm done. Here we go. Question number 24. Cleo is diagnosed with osteoporosis. Michelle, appreciate the heart. Thank you. Which electrolytes are involved in the development of this disorder? Is it calcium and sodium, calcium and phosphorus, phosphorus and potassium, or potassium and sodium? Jade, thank you for the follow. Appreciate it. All right, so we got B's all over the place. Got B's. Okay. Throw some B's on it. All right. Oh, A right. I'm sorry. My bad. Cleo. Okay. Look, Cleo, look at that. Look over here. Cleo, what's the answer, Cleo, since you up in here? I'm going to give y'all 10 more seconds. Who's Kelly? I don't know who Kelly is, but Kelly says B. Brittany, that is a different way to spell your name with an I. That is different. User 48 says D. All right, here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is B. The answer is B, calcium and phosphorus. In osteoporosis, bones lose calcium and phosphorus salt, becoming porous, brittle, and abnormally vulnerable to fractures. They work together if one is low and the other is low. Shit, yep, they sure do. User 30, appreciate that. All right, we always... My first name starts with an... Oh, okay, I got you. My bad. Oh, my goodness. All right, here we go. Well, on to the next one, y'all. On to the next one. Here we go. Question number 25. Johnny Football is a firefighter. Was involved in extinguishing a house fire and is being treated for smoke inhalation. All right. He developed severe hypoxia, 48 hours after the incident, requiring intubation and mechanical ventilation. He most likely has developed which of the following conditions? Is it adult respiratory distress syndrome, atalectus, acetaminophen? No, I'm just playing. Bronchitis or pneumonia? Got A, okay. Saying ARDS, pneumonia, okay. All right. Helping nurses retire. Look, you can help me retire, like for real. But you said A, so. Oh, hell no. Bailey says B, okay. Sarah says A, okay. Shout out to all 291 of y'all. If you guys are new, we're doing NCLEX questions. Smash that like button. Make sure you guys share. Joanna, you ain't got to yell at me, okay? I see you out there. All right, smash that like button, share, and follow. All right. I want to know who you are, where you're from, and where you're at in your nursing journey. NCLEX next week is on this. That's what I'm talking about. Oh, your test next week. Okay, not NCLEX. All right, here we go. Here we go. Numbers went up. Yeah, I see that. In 3, 2. Jorge says he's in nursing school. Shout out to you here. And our answer is ARDS, adult respiratory distress syndrome. Severe hypoxia after smoke inhalation is typically related to ARDS. So here's another thing too, is if you guys buy these other programs, their rationales are a little bit more in depth. Like if you're getting UWorld, or if you get Archer, or if you get Kaplan, or anything else. So just be aware of that. Sometimes they're not just cut and dry. You know what I mean? So yeah. So don't be discouraged by that. Okay. All right, here we go. Real quick. NCLEX questions. That's what we're doing. Make sure you guys participate. The more likes I get, the more questions y'all get. Don't troll my chat. I got these questions off nurselabs.com. 7-day NCLEX course is $48. It's yours forever, by the way, if you get it for $48. And it's pre-launch phase. It's bootnurse.com. You can check that out. And if I help you pass NCLEX in any way, shape, or form with a live, DM me. Don't be greedy with your life. All right, here we go. Here we go. Question number 26. What are you guys using, Archer or UWorld? Neither. I literally just said that we're using nurselabs.com. Kayla. Come on, Kayla. All right, here we go. A 67-year-old client develops acute shortness of breath and progressive hypoxia requiring requiring right femur. The hypoxia was probably caused by which of the following conditions? Is it asthma attack, atelectasis, bronchitis, or a fat embolism? Phew, I remember taking the NCLEX 2 years ago. I had PTSD. Ma'am, I do these things 3 times a week, and I look at NCLEX style questions all the time. How do you think I feel? All right, we got D's. If it's his femur, how did you just say? Look, I said it however I thought it needed to be pronounced. Does this look like a spelling bee on ESPN? I think not. But this is the one that they call a stupid question. But this is what we would call a stupid question. I wouldn't necessarily say we would call it a stupid question. I would say we would call it one of those questions that is possibly not above. It is either above or below the passing line. What's the answer? Look, hey, Joanna, you just got here. Relax. So I'm letting people answer. All right. Laura, thank you for the follow. We aren't doctors. You're right. You're soon to be nurses. So here we go. Here's our answer in 3, 2. And the answer is D. Long bone fractures are correlated with fat emboli, which cause shortness of breath and hypoxia. So if it's starting to cause shortness of breath and hypoxia, what is that fat embolism? What is that eventually going to turn into? What is it going to turn into? Can you do one-on-one? I do one-on-ones, actually. If you go to my link in my bio and you see where it says NCLEX Coaching and Mentoring, that is my one-on-one. Pulmonary emboli, pulmonary embolism. Joanna, you're not dumb. You just did. If you don't know what you don't know. You know what I'm saying? Petechiae? Yeah. But I'm talking about ultimately what will be our problem, and our problem would be a pulmonary embolism. Sorry for yelling. Yeah, you know better, Cass. Don't do that to me. Hannah, thank you for the follow. All right, here we go. Question number 27. A client with shortness of breath has decreased to absent breath sounds on the right side from the apex to the base. Which of the following condition would best explain this? Is it acute asthma, chronic bronchitis, pneumonia, or a spontaneous pneumothorax? Every time I say pneumothorax, it reminds me of the Lorax, and I don't even know why. I don't know why. Appreciate everybody for the likes and the follows. I don't see the link. The link is in my bio. It's on the link. It's on the link tree. Like it's right there. You can click on it on my bio. So you would have to get out of the live and then go into my bio. D, I'm not a nursing student at all, but I'm guessing. That's okay, GMT. Thank you for the follow. All right, so think about it, right? If I have shortness of breath and then now I have no breath, what do I think that just happened? All right. Here's our answer. Here is our answer. KK says pneumo all day. KK, pneumo all day. That's what I'm talking about. Here we go. Here's our answer in 3, 2. And the answer is D, a spontaneous pneumothorax. That occurs when the client's lung collapses, causing an acute decrease in the amount of functional lung used in oxygenation. The sudden collapse was the cause of the chest pain and shortness of breath. Period, boo. We said weak program. I don't know what you mean. What do you mean, Sean? What do you mean? All right, here we go. Shout out to all 400 of y'all up in here. Hey, if you guys are new here, make sure you guys let me know where you guys are from. Like, share, and follow, as well as who are you? Where are you at in your nursing journey? Well, let us know. Let us know. Question number 28. A 62-year-old male client was in a motor vehicle accident as an unrestrained driver. He is now in the emergency department complaining of difficulty of breathing and chest pain. On auscultation of his lung field, no breath sounds are present in the upper lobe. This client may have which of the following conditions? Bronchitis, pneumonia, pneumothorax, or tuberculosis. Cindy, you changed your answer? Are you sure? You sure you mean C? I know you ain't out there changing your answer. We got C's. Tuning on my EMT from VA. Shout out to VA. I got some folks that live out there. Gloria, appreciate the follow. Hey, if you guys are new here, we're doing NCLEX questions. Make sure you guys like, share, follow, smash that like button. Make sure you guys follow me. I'm kind of funny. And share. Don't be greedy your whole life. Been a nurse for 18 years. I sure hope what? I sure hope I know this answer. Cindy, it's okay if you don't know the answer. I ain't gonna tell nobody, girl. What you mean? I ain't gonna tell nobody. I ain't gonna tell nobody, you know what I'm saying? So, I'm gonna give y'all about 15 more seconds. We got C's, okay? Okay, wow, there's a lot of people in here today. Look, I think at one point in time, I had 1,100 people up in here, and I'm just like, what? So, I hope this is super helpful for everybody. Hey, I do these every Monday, Wednesday, and Friday at 5:30 Central Standard Time, Texas time, because that's the only time that matters. So, but no, I do these every 3 times a week. So if you guys are interested, make sure you guys like me, share me, and follow me. That sounds kind of weird. All right, here's our answer. 3, 2, and the answer is C. Pneumothorax is defined as the presence of air or gas in the pleural cavity, which can impair oxygenation and or ventilation, right? So shout out to everybody that picked the letter C. I can remember from anatomy being your Yeah, there you go. All right, here we go, y'all. Here we go. On to the next one. All right, question number 29. If a client requires a pneumonectomy, all right, let's think about our medical terminology. What is a pneumonectomy, right? Pneumo and then ectomy. What does it mean? What fills the area of the thoracic cavity? Is it A, the space remains filled with air only? The surgeon fills the space with gel. Is it C, serous fluids fill the space and consolidate the region? Or is it D, the tissue from the other lung grows over the other side? 5:30 Central Standard Time. So we got C's all over the place. Throw some C's on it. Enzo, appreciate the follow. You said D. What you mean? You don't know? That could be the answer. It's definitely C. Look, you don't even know. You know what I'm saying? Nah, you probably do know. Haley, thank you for the follow. Brittany, thank you for the follow. Man, we got a lot of Brittany's up in here. Jill Martin says, I don't know. That's okay. If you don't know it, that's okay. But you gonna know it after this. CC and Jesus. What was that? No, that was Jose, not Jesus. Obviously, I'm blind and dyslexic. Here we go. Here's our answer. In 3, 2. Our answer is C. Serous fluids fill the space and consolidate the region. Fill the space, consolidate the region, preventing extensive, mediastinal shift of the heart and remaining lung, right? It can't be A, they're removing air. Yeah, they are. Yay, I got it right. Shout out to you, Ari, for getting it right. Shout out to all 500 plus of y'all all up in here. I want to know who you are, where you're from, where you're at in your nursing journey. Smash that like button, share, and follow me because, I'm kind of cool. Sometimes I'm controversial. A lot of people don't like me right now, and I'm okay with that. Here we go. Question number 30. ICU travel nurse here. Shout out to you, Becca. Rebecca, respectfully, you know what I'm saying? Hemoptysis may be present in a client with a pulmonary embolism because which of the following reasons? Is it the alveolar damage in the infarct area? Joanna, there's your favorite word right there. Is it B, involvement of major blood vessels in the occluded area? Is it D, loss of lung? Is it parenchyma? Or is it D, loss of lung tissue? We got B, live in Massachusetts, RN for 36 years. Look, who said that? 36 years. Let me go back. Is it a Dungeon 8? You've been a nurse for 36 years? Well, I turned 36 at the end of this month. I have no idea how that makes you feel, but I already love and respect you, so I appreciate you. All right, what are we doing? All right, B, makes sense. All right, Junebug, I see you. Michelle, thank you for the follow. Thank you for the follow. All right, I see hemo and looking for an answer with blood. Young, I am. Yes, I am young. I don't feel young. I feel old. I blame the Navy. So there we go. All right, y'all. All right, y'all. 5 more seconds. Here we go. Thank you guys for the follows. Appreciate it. I live in Houston. I'm not in nursing school. Got my biology, though. Shout out to you. Pulmonary is heart. RTT. Shout out to my RTs. There goes one right there. All right, here it is. Here it is. Here's our answer, y'all. In 3, 2. I'm a linguistic student, but I always watch these for fun. Shout out to you. Hey, it's nothing but good info out here. And the answer is A, alveolar damage in the infarct area. Joanna, there's your favorite word again. The infarct area produces alveolar damage that can lead to the production of bloody sputum, sometimes in massive amounts. So that is the answer, ladies and gentlemen. Like I said, I want to know who you are, where you're from, where you're at in your nursing journey. And ladies and gentlemen, we started at 5:30 and we are done. We did 30 questions today. I appreciate everybody for participating. But right now, we're going to do an AMA. So on Ask Me Anything, I'm going to turn this camera around. You guys can look at my gorgeous, just amazingly delicious Jason Derulo face. And you guys can ask me questions about nursing and all that other good stuff. I didn't have to ban nobody today, which was cool. If you guys want to know what those questions are, they were from nurselabs.com. Of course, check out the 7-day NCLEX course in thebootnurse.com. Those links are in my bio. Also, look, if I helped you pass NCLEX, just go ahead and send me that DM, baby. All right, here we go. I'm going to turn my glorious face around so you guys can see. What up? Hey, how y'all doing? How y'all doing? My name is Kevin. Jason Weaver, what? I said Jason Derulo. What? But my name's Kevin. I go by the Boot Nurse on all those social media platforms. A lot of people are asking me, like, am I a scam? I'm very much not a scam. I am very much a real person. My birthday is, when is my birthday? It's at the end of this month. That's when it is. So I love working side by side by such wonderful nurses. RT here. Love nurses. I'm telling you right now, I learned everything I needed to ever know about a vent from an RT. And it was awesome. And I loved every bit of it. Jason Derulo. That's what I'm saying. Boot Nurse, what's up? What's up? What's up? Spooky season birthday. Look, Scorpio season, baby. We ride around the corner. Hey, so I want to know who you are, where you're from, where you're at in your nursing journey, what questions you guys have about embarking on a nursing journey, in nursing school, becoming a nurse, non-traditional stuff as being a nurse. You know, like, what do you guys want to know? Let me know. Are the questions available? What questions, James? What do you mean? So is mine. Yep, Scorpio birthday. Also, RTs know the vent. They better know the vent. That's their bread and butter. They better know it. After this study, I am risen by the boot. This guy. I appreciate the follow, guys. Thank you. November 1st, what? You take your exam or you graduate? What are we doing? Oh, that's your birthday? Jan? Is that your birthday? So just graduated from my LVN program, waiting for my test date. Okay. Let's see. Do you think MedSurg is a good place to start as a new grad LPN? If you don't know where to go, yes. Or if you don't have a specialty area that you can go, then MedSurg is a good spot. I don't shit on MedSurg. I just know that I didn't go to MedSurg. I know I didn't want to go to MedSurg and I didn't go. And I was okay with that, but MedSurg, if you don't ever know where you want to go, they will definitely set a really great foundation for you. How did you know, you wanted to, wait, what? How did you know where you wanted to land after you finished school? I knew I wanted to be ICU for as long as for 10 years before I graduated, because I wanted to be a CRNA. That's how I knew, and I just kind of stuck by that path. Cynthia, New Jersey, just finished LPN, about to take my NCLEX. Shout out to you. Birthday, okay. Started nursing school in the spring. Shout out to you. I graduated in December. Okay, yes. Dabble from Seattle nursing school, 5th quarter. Shout out to you. Appreciate the follows. How do you know where you were? I think I just answered your question. So, graduated in December. What was your nursing journey? So far? Look, do you got time? I'll tell you in a second. I say ER is the best place to start. You learn a lot of everything. It all just depends on what you want to do and what your passion is. Like me, I went straight to the ICU. And my first ICU that I worked in, which was the burn ICU, I loved it. Then I went to a medical and a neuro ICU at a different hospital, and yeah, it was not it for me. Does nursing school start after grad or during undergrad? What do you mean? So nursing school is an undergrad program. I work in pediatric oncology. Shout out to you. I know a few of my friends actually work in pediatric oncology at the University Hospital. I'm from West Virginia, 10 weeks left. Graduate December 5th. That's what I'm talking about. Taking my NCLEX in New Jersey. Shout out to Jersey. Just graduated EMT program, going to med school. Thanks for what you do. I appreciate you being here, man. I really do. I work corrections, so you be beating motherfuckers up. I'm just playing. Mommy of 4 LPN student. Hey, you about to be a mommy of 4 and an LPN. ER, you learn a lot. Any tips for new nursing students? Get into a small group. You 3 other people, split up the notes 25%. You do 25% of the work. You get 100%. You reap 100% of the benefits if everybody does what they're supposed to do. So I'm scared of the ICU. They are amazing and intimidating. It just depends on what ICU you go to. You're a repeat test taker. Hey, I failed my NCLEX, y'all, 3 times. 3. First time was at 75. Second time was at 265. The third time was at 106, and then I passed on my 4th time. All right. Don't be scared of that exam. There's nothing about that exam that's going to change when it comes to content. It's all about you, your mindset, and how you approach it. Okay. Should I start studying for NCLEX even though I didn't enter my master's school yet? I don't know. I don't really kind of understand your question. I think I want to do peds. Then go do peds. What does undergrad mean? It means your undergraduate is your like going to like a 4-year university. Right. And then when you want to go to a graduate level program, that is after the 4 years that it takes for you to get a bachelor's degree. It says, what about, I want to ask that when you done your bachelor's, you go to nursing school. Joanna, I don't even know how you said that. Like, say that again. Can I get straight into an MP program after I graduate nursing school? So it depends on the MP program. Some MP programs will require, most MP programs that I know of require you to have at least 1 year of nursing experience before you can apply. That's for Broke Boy. Oh, shout out to you, Broke Boy, for being up here. I always hear rumors about them phasing out LPNs, but then hear that they're in demand. What's true? They're not phasing out LPNs. You want to know what? They tried to phase out LPNs. And then guess what happened in 2020? The Rona came and got everybody's ass. And then all these hospitals are just like, oh my God, we love you. Please just come back. And then they still, relatively treat LPNs like shit. So why would they get rid of LPNs? It doesn't make sense. The demand for nursing, all broad spans of nursing, so RN and LPN and NPs, they're needed. So if you got rid of LPNs, there goes like 40 to 50% of the entire, like the nursing force. What sense does that make? It wouldn't happen. The exam is book knowledge, not real world. Correct. I failed the NCLEX first time by 26 points. What? Was it based off points when you took it? Because you don't really see your points now. It's all based off of, like the 8 sections of the NCLEX pie. I had to think about who said that. So you took the NCLEX, or so you took it 4 times. Not too bad. At least you passed. So here's the thing. None of y'all would have known I failed the NCLEX unless I told you. No one is ever going to ask you that, ever. Hey, how many times you take it? How many times you fail? Blah, blah, blah. No employer is going to care. No one at your job is going to care. The only person that'll care is probably the only person that's going to care is you. The person next to you is going to be like, oh, damn, that sucks. They don't give a fuck about you because they care about passing their own test. So if you fail the NCLEX, hold that shit on your fucking shoulder and realize that is a stepping stone, right? I like to call it, for me, I was unsuccessfully successful because I was unsuccessful 3 times and I didn't stop. I didn't give up. And then eventually I passed the exam. That's it. And that's how it goes. All right. So like I said, no one's going to care. Thanks for advice. I hope to join you next time. Good night. Good night. Miss B, what's up? Oncology. I can't seem to find a study habit. You have to audit yourself. Like, if you can't find, trust me, you can find a study habit. You're just not looking hard enough. I started nurse school in January and I'm ready. Go get it. How long are most MP programs? They can be anywhere, I think, from like 2 to 3 years. It just depends. Week 7 of nursing school. So don't know too much. But ready to learn. Like I said, get yourself into a group of people that that you actually vibe with, not a bunch of fools that are out there. I started nurse school in January and I'm nervous. Don't be nervous. Love your life, bro. Hey, bro, I appreciate you being here, man, and asking your questions. I wouldn't recommend that. Always have a few years experience before moving to MP. Once again, Jamie, that is debatable. There's a girl that I worked with in the ICU. She was in the ICU for a year. She's already jumped into an MP program. There's another girl who worked in oncology for a year and now is already in an MP program. So it all just depends. RN with a BSN is now, RN with a bachelor's degree is now required. What are you talking about, Maria? Dale says, thank you because I started nurse school in January and I'm very excited. Be excited. It's going to be rough. How long are most NPN programs? I said that. I got 2 job offers. What tips do you have for me to pass the NCLEX first time since residency is in February? Cass, I think we already talked about that. Didn't we already talk about that? How often do you do these lives? I do them every Monday, Wednesday, and Friday at 5:30. Yes, it was points back then. Okay, that makes sense. Absolutely nobody cares. That's what I'm trying to tell you. I already answered your question. I always get near pass range, but hope to get all above next time. If you're getting near pass, you were teetering the line. So if this is the passing line, you're doing this. You're like doing, and so when you're doing this, the exam doesn't know. They'll be like, well, shit, she's doing well, or she's not. You know what? Let's wait it out and let's see. So 9 times out of 10, you're probably getting to like 150. What do you think about med techs? I love techs. I love them. So I'm a hospital corpsman in the Navy. So, we're equivalent to LPNs. And, I've done tech work. So I highly, highly respect and I love techs because they're an extra pair of hands. I love it. Do RNs now require a bachelor's degree? No. You can, like, RNs have an associate's degree and a bachelor's degree. What were the sign I needed? What? I haven't been studying. Oh, I was the sign that you needed. I got you. I haven't been studying for NCLEX and need to do it. Yep. Because only you can do it. And if you don't do it, it's your own fault. Everything is your fault. Everything. And I'm not just saying that directed towards you. I'm just talking about everybody. This test gives me anxiety. So if the test gives you anxiety, you need to recreate the testing center, especially if you've seen it. I could change my whole office into a testing center right now. Get no phone, no drinks, no nothing. I could bear room, like take everything off the wall, do everything, right? So you have to practice like you play. Practice on what the exam center looks like, recreate it, and then sit down and every day or every other day do 85 to 150 questions. That's the only way to get through it. Do you think going to MP is worth it? It depends on you and what you want to do. I don't want to be an MP. At one point I did, and then I didn't want to do it. I want to be a CRNA. At one point I did, and I don't want to do it. So it depends on you and where your heart lies and what passion that you have. Like I'm telling you, nursing is like the earth. There's so many things that you can do with it. Right now I'm in college and it's my first year, and now I'm deciding to transfer to an LPN program. Okay, shout out to you. Remember the Thomas Edison failed 99 times, invented the light bulb, right? Sure did. Let's see. Grad back in May and worried I've waited too long. Canadian that went to an American school. Well, you better jump back on it. Is bachelor's degree now required? I already answered that question. I think you said Archer review, but I'm not sure. I just need to make sure I pass the first time. So I think I did. I said what they have: Archer, Kaplan, they have UWorld, they have Remar, NCLEX High Yield, they have Hearst Review, they have Mark Klimek, mine. But I said not mine because it's not. It wouldn't be ready for you by the time you were. Well, it might be, but it all just depends. But I would say the biggest thing is that you need to recreate the testing center. Start with the very hardest section that you feel is hard for you. You need to create a study plan. You need to create a testing or a time management sheet, like an audit sheet. You just need to get to work. What it says, do you think nursing or NP role will be inflated over the next years? No, I don't. Awesome. I just sat and looked at the test. Everything went out of my head. Second test was all cardiothoracic. The ones who go straight to NP from RN don't have real world experience and can't relate. You're right. They can't relate, but that doesn't mean that they're not going to be able to pick up things faster. Hell, I've seen nurses been nurses for 5 years go be NP and then they question everything that they do. They have imposter syndrome, just like everybody when they get a new position somewhere, So I don't discourage people from doing it, but I do make them aware, like, hey, it might be a little bit easier. It might be better if you have more experience. So I get anxiety taking nursing tests. Well, you got to practice that. Got it. Can't wait to pass. That's what I'm talking about. Naomi says, what do you think about Kaplan as a study resource for NCLEX? Naomi, go to my YouTube channel or type in Kaplan NCLEX review. And then you're going to see, I think I'm like number 3 or 4. You're going to see like my big old face. And I did a whole 14-minute review on Kaplan. So go check it out. It goes into detail too. And on OB, Lace one exactly true on what you're saying. Facts. I have test anxiety, but I'm trying to get over it because I start school in January. So sometimes you have to put yourself in that position. So if you have test anxiety, go to places like, nurselabs.com and recreate a testing center, recreate those things. Put yourselves in those situations to make you uncomfortable now. That way, when you get to where it's real, you'll be comfortable doing it. All right. I reviewed with Kaplan. It was awesome. I did too. If you're interested, just do it. Determination. Facts. Thank you. Sounds good to me. everyone has imposter syndrome. I think that's what you said. Everyone has imposter syndrome when they start out. Take approximately 3 years to overcome that. I wouldn't say that. That's all person dependent. That's all person dependent. There's some people that just pick up on stuff really fast and they get it in a year or a year and a half. For the imposter syndrome, not to say you're an expert, I would definitely not say a year, not like at all whatsoever. That part I can agree with. But it says pass the NCLEX, but never was able to get experience because no one wanted new grads. Vanessa, that is actually the saddest thing that I've ever seen. And I'm going to tell you why. It's because these hospitals are putting essentially a racket on like who they see, because they want to put new grads into residency programs so they can lock them into a contract. That's why. Like, there's residency programs out here, but these hospitals are locking. They won't just hire a new grad. They want to put them through a residency program so that way you sign a contract with them, they give you a bonus or whatever money, and they lock you in. And then you feel like you're trapped and you can't leave. And then you're working in a toxic environment, or you're not being taught correctly, or they give you unsafe patient-nurse ratios, or, they have the mean girl effect in your unit where people are rude and disrespectful to you. Like, the shit can go on and on. So that is the true reality of it. However, depending on what type of nurse that you want to be, there are things that you have to do. So if you want to be an NP, you need to know what NP you want to be and what are the requirements. If it requires you to do a year of med-surg bedside, you got to go med-surg bedside. There's no ifs, ands, or buts about that. You want to be a CRNA, you have to do critical care. There's no way you're getting into CRNA school without critical care. If you want to be an acute care nurse practitioner, you have to work in critical care in order to get that. Like an acute care. Like, most of the schools will say acute, at least 1 year of acute care experience. Okay. I rescheduled my test 3 times, so I'd have more time to study. Hey, I just want to let you know, the more that you keep rescheduling it, eventually your application is going to expire. All right. So I'm just going to let you know that right now. And secondly, if you keep don't be scared of that test. If you keep rescheduling it, all you're doing, first of all, you're denying the inevitable. You are denying the inevitable. So don't do that. All right. Give yourself ample time. Honestly, in reality, you don't need any more than 90 days. You don't need any more than 90 days to study for your NCLEX. Like, when I studied heavily and I had a game plan for myself, 54 days. 54 days. And that's what days off. It was 54 days total, and to include days off, right? Like 1 or 2 days a week, right? It's crazy. I get on here and you're the first video to pop up and I needed to hear what you were saying. That's what I'm saying. That's what I'm about. You know what I'm saying? Like, I'm tired of these people out here playing games. You know what I'm saying? I'm all about being a nurse. I worked very hard to become a nurse. I'm very proud of my journey of becoming a nurse. But the one thing I will not let a motherfucker do is play with me. I will not let them do it. I don't care who you are. Because if you work hard for your license, people will try to play with you because it's not theirs, it's yours. You know what I'm saying? So, nope, I don't play that. The residency program is excellent for new nurses. I don't disagree with you. The program, depending on where you go, the program is good. And it depends on the residency program that you go into. Like, it says, like, they want you to go to residency programs. They won't just hire you, like, as a new grad. Like, they're going to make you go through that. That's the thing that I'm saying. I'm deciding to go outpatient. Hey, if you got connections to go outpatient, why not? Do not study the night before the exam, get a good night's rest, and have a good breakfast. Facts. I would agree with that. How about for outpatient? What experience do I need? Outpatient is like clinic work, but it just depends on what clinic you are. You're right. I passed my NCLEX on my 75th question back in the day. It wasn't even that long ago, but back in the day. This is true. Don't put it off. Have confidence and do. Yep, you can do this. 54 days for what missed. What he said. What? Oh, Joanna, I said I studied for 54 days on the NCLEX that I studied for 54 days, and that was with days off. So I took it the first day I could. So, like, and the thing about it is, like, if you're just out of school and if you want to take it 2 weeks after, cool, because all of that knowledge is still, relatively new in your head, right? All of it is still relatively new and it's fresh. That's why I say that. Now, if you're somebody like me who failed, like, now I got to go back to the drawing board because now all that information has kind of just left me. I was discouraged, so on and so forth. But now I'm just like, all right, cool. Now I'm back to the drawing board. Okay. She says, true. Got it. Thanks. I'm in this weird limbo because passing the NCLEX and starting my RN job, it starts November 6th. Okay. So in order to not be in that weird limbo, you need to pass. So that's what, a month from now, almost a month from now, that you need to pass your NCLEX and then go take that and then go get that job. So the question is, what are you doing? What are you doing to fix that? Like, what are you doing to get it? What are you doing to prepare yourself for the NCLEX so you can pass on the first time? Are you recreating the testing center? Do you know where your toughest area is? Is it maternity? Is it management of care? Is it pharmacology? Like for me, it was pharmacology, right? Do you have a study plan for yourself? Do you know what to study each day? Do you know what content to look over each day? Do you know how to remediate your questions? Do you understand the questions? Do you understand what they're asking you? Right? Because remember, the NCLEX is all about nurse safety and basic nursing skills, right? I don't expect for you to go out there and know how to drop an A line, and y'all won't be dropping A lines unless you're like a CRNA. I don't expect for y'all to know how to do that, right? I don't expect that at all. However, I do expect for you to know what the signs and symptoms are of somebody, if they're having shortness of breath. That's what I do expect, Sorry if you guys hear my son. He's doing something over there. I passed already. I'm just waiting for the job, and it feels weird having all this free time. You better enjoy that free time. So, I won't even say that. I won't even say that question's necessarily for you. However, that definitely can be helpful for somebody else. 100%. All right. Hey, so we got 80 people up here. I appreciate you guys rocking with me. Of course, you guys can still share. You guys can still follow, and you guys can still like this live stream. If you are new here, my name is Kevin. I've been a nurse for 3.5 years. Oh, a little bit of backstory about me. I've been in the Navy, like I said, for 16 years. I've been on 2 deployments. One was Guantanamo Bay. The other one was in Afghanistan. One was in 2008, 2009, and then 2012, 2013. And I've been an instructor. I'm a master instructor in the Navy, and I've been one for 8 years. I taught in a surgical technology program for about 3.5 years. And I've taught, a plethora of other certification courses like TNCC, pre-hospital trauma, tactical combat casualty care, advanced burn life support. I was a BLS instructor as well as ACLS instructor. So, those were when I was still active, which was about 2 years ago. And I'm just letting you guys know, I love this teaching shit. I really, really do. And, so whatever questions you guys have, just jot them at me right now. Let's see. When are you planning to get off? Why, Joanna? Why? You kicking me off or what? I thought he was sleeping. Your kid is too cute. He's a demon. That's what he is. Passed my NCLEX on my first. I'll pass my first quiz in LPN school, and I'm so proud of myself. Be proud of yourself. Be proud of yourself. Hey, take all those wins where you can get them. Tips on health assessment. You start from head. So if you're doing a health assessment, you're going to start from head to toe. Head to toe. You're going to be looking for anything that stands out to you. So if I'm looking at the head, I'm seeing it if there's any lacerations or if they have any bulges, any discoloration. Work your way down. Look at the eyes. You're going to mark down everything that you see, starting from head to toe. So head and neck. Thoracic area. Chest, shoulders, arms, front and back. Work your way down. And then the whole part about assessment is whatever you do on the front, you got to do on the back. All right. Is doing questions every day enough? I'm using Archer. Yes, I would think so. No. So let me re-answer that question. Is doing questions enough? It depends on your level of content. Do you understand enough content in order to answer your question? Some people are just bro, I don't know. Me, I always tell people, hey, get you some content because you never know what you don't know. So for me personally, when I took my exam, questions were not enough. They were not. So when am I planning to get off? I don't know. Probably here shortly. Probably in the next 20 minutes, maybe less. How much did you make last year? Well, that's a bit of a personal question. Guantanamo Bay, wow, so cool. Yeah, not really. Thank you for your service, sir. Appreciate your support, Vicky. Thank you. I shared with Goder, what? Who will graduate from nursing school a year from December. I don't even know. Oh, you shared. I got you. I see what you said. You are good at it. I appreciate it. He must be 3. No, he's 18 months actually. No, just asking when your live stream learn so much. Oh, yeah. So I'll probably be getting off here like in the next like 10, 20 minutes. So I wish this was available when I took my NCLEX 26 years ago. Look, I wish that I even knew people did this on TikTok when I was studying for my NCLEX in 2018. TikTok or on Facebook Live or whatever. I just never thought about it. And then next, boom, here I am doing it for everybody else. EKG readings. Very true. Question today. What's your question, Brandon? Your goddaughter. Oh, okay. I see you. I see what you're saying. Yeah, share. Hey, share with her. Whatever works. But Brandon just asked a question. Brandon, what is your question? Sure. All right. Shout out to all 72 of y'all up in here. I want to know who you are, where you're from, where you're at your nursing journey. We're doing an AMA, like an Ask Me Anything in regards to nursing, pre-nursing, nursing school, NCLEX, your first year or your first, new grad experience. What do you want to know? You doing questions today? Sir, I already did questions. I did them at 5:30. And also, for all people that are here, all of my questions will go up on, they'll go up on YouTube. Like all the videos that I do right here, they will go up on YouTube if you missed it. Okay. So think about that. So if you I know there was a video that went up there today. So just curious how much you make as a nurse. I made $36 an hour in Phoenix, Arizona doing peds, home health care. As a brand new nurse, when I first started working, I made $25 an hour. And that was during COVID. And at that point, you're like, how in the hell, right? And then I've gotten probably, I think like a $6 or like a $7 or $8, like almost a $10 raise since then, right? YouTube name is The Boot Nurse. So everything that I have on social media is The Boot Nurse, every single thing. So you can find it everywhere. But that's at, that was like the new grad prices or whatever. So, and that's at the hospital. So now if I decide to leave the hospital, which I do plan on doing at some point in the future, then obviously I'm going to be making way more than that. So nurse 20 years in New York. Shout out to the NY Brooklyn Marcy Projects. I don't know nothing about any of that I just said. I am not a part of that world. So I'm sorry. Blame Dave Chappelle. That's why I said it. Jamie said 13 years ER trauma, 7 years pulmonary and sleep. Georgia. That's what I'm talking about. ER trauma. Jamie been in the shit. Been in the thick of it. Hey, look, I've been down there. I've been down to the ER a few times. You know what I'm saying? Upstate New York psych. Oh, my bad. I think that everybody, you can't say New York and then people not think people forget that New York is a state, not just a city. So if you guys are in other parts of New York besides the city, you got to specify. I can't be roping you in with the city folk. You know what I'm saying? So what other questions you guys got? What do you think about course point for by Lippincott for practice exams and questions for NCLEX versus Archer? Let me see. So I don't know if it's an online program or anything like that. This is for Brandy. But I have a Lippincott book right there. It's probably about this thick, and I have not opened it, not once, because you cannot put a book in front of me. I will fall asleep. That's another reason why I got freaking audiobooks, right? So I really could not tell you, but I can tell you that I do like Archer. I do like UWorld, but UWorld is, sometimes it's out of people's pockets. I like UWorld's questions, but that's all that they give you is questions and rationales, and not a fan. Florida wound care med surge, currently acute dialysis. Shout out to the dialysis nurses. So shout out to you. I learned a lot. Do I got any LPNs that are still in here? Because I'll be the first one to tell you that LPNs were the ones who taught me when I first became an RN how to do wound care. The ones that worked on the floor. So shout out to them. You know what I'm saying? So UWorld is good. UWorld is okay. UWorld is okay. I tell people hey, if you feel like you're good on content and all you want is a QBank, UWorld's QBank, Archer's QBank, Gucci. But if you want something that's all encompassing, I would recommend this, and this. So doing Hearst review. Look, I tried to do Hearst review, not even gonna lie to you, but Aunt Marlene, y'all, that country ass accent is a distraction. And it's what we call in the education world an environmental factor. And she very much to me is an environmental factor and a distraction, because I'm just I can't get over that. I can't get over the Southern Belle accent. I can't. I can't. It's not, and it's nothing against her. Like, and her material works. It's just for me, I'm just like, nope. Just like registered nurse RN, like Nurse Sarah off YouTube. Like I could only listen to her in spurts, and she's probably a fantastic lady. But man, I was just like, whoa, that thing thick. I can't do it. I recently used Kaplan. Is that good? I used Kaplan, and I actually made a whole review on it. You actually can go onto my series on my profile, and you can see where I did the Kaplan review. I put the Kaplan review out, like 3 years ago. I agree. LPNs are the GOAT. Taught me tons during my journey. Facts. That's why I don't understand why anybody would remotely treat an LPN the way that they try to treat them. I remember I went to a med surg floor, and there was an LPN there, and her and I were talking, and we were talking about something, and she said something to me, and I was like, oh, okay, cool. Let me show you how to do that. And she was like, you're going to what? I'm like, I'm going to show you how to do that. And she's like, why? She's like, you don't have to do that. And I was like, does nobody do that? And she's just like, no. And I'm like, huh? Like, maybe that's the Navy in me because, we teach, like we train all the time. So I just thought it was really weird. But, or like I trained one of the techs, like I was telling her about the chest tubes, and she was like, nobody's ever taken the time to teach me what the chest tube, what the purpose of it is. And I'm just like, I got you. Let me show you. I did a terrible drawing, but she really appreciated it. We have to do it for school. Yeah. So here's the thing. Oh, you have to do it for school because it's probably embedded in your program. I use Saunders' book and UWorld. I recommend, look, I don't recommend nobody using the Saunders book because I don't like that book at all. That's just me though. But I tell them, I'm like, hey, Saunders' book is there. What do you think about simple nursing? I love his YouTube channel, especially the one about cardiac meds. So, okay, thank you. I've been trying to use the decision tree, but still a little unsure on how to use it. Hey, I'm gonna break it down for you. So the decision tree is essentially it's ADPI and Maslow's, right? That's all it is. So the very first thing, if I give you a question, right? I'm putting you on game right now. This is usually what I teach people when I'm doing one-on-one coaching, right? So ADPI and Maslow's, right? So the very first thing is like, we want to see what the topic of the question is. So if the topic of the question is telling me whatever it is, all right, cool. So now that tells me I can generate my focus towards that specific topic. So if we're going to talk about congestive heart failure, I'm going to be like, oh, the patient has, has crackles, has pink frothy sputum, yada, yada, yada. What should the nurse do first? And I'll be like, oh, that sounds like, some type of cardiac issue, or it's congestive heart failure. I know that that's a sign and symptom of congestive heart failure, right? So now what do I do? Now, is there enough information inside of the question to where I need more information, or do I just go ahead and do it, right? So do I need more information where I need to assess, or do I just implement? Do I just go straight into it, right? And if you have to assess and you need more information, okay, now I need to know, like, okay, I'm going to assess before I implement, right? And then the next thing is just like, is it physical or psychosocial? So what takes priority? Is it that I'm physically dying, or that I think I'm going to die, right? That's how I relay it. And then we're going to go to ABCs, right? But with ABCs, it can be a little tricky because you also want to throw in the level of consciousness there, right? Your LOC, level of consciousness, right? And then once you determine if it's an ABC, then you evaluate, like, which one do you pick from? And then once you determine which one you pick from, you can narrow down your answer. All right? And that's pretty much what the decision tree does. That's pretty much what it is. Exactly. LPNs equal real world nursing. As an LPN student, would you recommend me to watch I Hate Reading Books? To watch what? What do you mean, Anita? I was taught by nurses when I was an undergrad nursing aide. They were my foundation of an RN. Facts. I'm telling you, you find one good person who's a nurse, either an RN or LPN, that will show you how to do stuff. Like your whole thought process is after that, and it's golden, and they are invaluable at that point. YouTube to know my topics. What do you mean? YouTube to know my topics? What do you mean? I don't understand the context of how you're asking that. So, since I struggle reading the books, should you look at YouTube for your content? Yeah, or for your topics? Yeah, why not? If you don't want to spend the money, why not? I think it's amazing for learning real world skills, but recommend RN for the reason behind what? What do you mean, Jamie? Oh, yeah, there you go. Jamie, what do you mean? I think it's amazing. I think it's amazing for learning, but recommend R for the reason. I learned from everyone, LPNs, aides, doctors. I was taught and shown so much. See, since you were a nurse, like, oh, not saying since you were a nurse, but you've been a nurse for such a long time, you definitely can say, like, you've been inside this time capsule and you've seen how it's changed. And it's probably, and I could probably almost guarantee that it's probably nothing for how it was when you went to school. So, or how, you could be with one preceptor or two preceptors, not end up with 9, like I did. I ended up with 9 preceptors, and the one preceptor that I wanted to keep, they were just like, no, you have to go to nights, flat out. And the one I was just like, no, well, I need more. Like, she's great. Like, she was very helpful. She taught me a lot, and they were just like, nah. They pretty much told me to just go F myself. I was like, all right, whatever. So, like I said, it's just like when you get passed around, when you get passed around the unit, like the what's the word, like a fallacious individual. Man, that's a good word. But like when you get passed around like a fallacious individual on the whole unit, and I wasn't the only one. Almost all the new grads did when I was there. Then you don't get any continuity, nothing. Everyone's going to tell you something different. Anything that if you do something right with them, it's going to be wrong with them. Some people try to be rude and demeaning to you because you're new, all that other stuff. And I'm like, nah, bro. Like, I have a lot, like I've been in the military for 16 years. I am not going to go into a field and then have somebody talk to me like they lost their damn mind. Not happening. Any tips to learn dosage calculation? What is it? Dimensional analysis. Been in healthcare since 95, and the new generation NCLEX is throwing me bad. Really? I actually think, hindsight's 2020. I think that the case studies being thrown in there are actually an excellent thing. Thankfully, I was able to train a new nurse from beginning to start. No passing her around. Jamie, I love that. Like, I love the fact that you had that ability to make that happen, because I'm telling you, once a student finds a mentor, or mentor finds a student, like, that relationship is locked. And then like if you can lock it in. And the one that I had locked in, it was like I was snatched from it. And I feel like my whole thought process on the ICU would have been 1,000 times better, but it wasn't. So I've been in nursing so long, I still aspirate on IM injections. Hey, look, I ain't gonna tell nobody. I still love to learn even after 20 years. We're always learning. That's a whole great thing about nursing, or medicine in general, is that it changes all the time. What concepts do you recommend going over before starting nursing school? I would definitely say anatomy and physiology. Oh, and if you've taken pathophysiology, you're studying the disease processes, how they affect the body. Great course. Unfortunately, some seasoned RNs are cruel to new ones. Oh yeah, for sure. I had one who was a nurse for 4 years. Talk to me like, when I tell you talk to me like she lost her, like I was her husband or I was her kids. I turned around and I was like, hey, I don't know who the fuck you're talking to. I was like, but I'm not your husband and I'm not your son. And I was just like, so if you're going to talk to me like that, you can like I said, I've been in the Navy a long time. So, yeah, needless to say, like, I never worked with her again. Case studies are amazing. They lead you, they lead you if you know your content. Exactly. Which is why I always harp on content. I'm a very big content guy because I felt like I didn't know a lot of it when I was in school. So hell, I was just thrown in after 2 days. And the thing about it is, like, I don't like that. When people say that, I hope they don't wear it as a badge of honor, because it's not. It's not a badge of honor to be just thrown in somewhere and you just figure it out, because your life, livelihood, and someone else's life is at stake for somebody who was just like, hey, trial by fire. Nursing is not the fucking place for that. It's not. Sorry if I'm cursing too much. Sorry if it's not enough for you, or sorry if it's too much for you. But I'm just being all the way honest. It's just like, I'm going to tell y'all what the deal is. And other people who have been nurses longer than me will definitely tell you the same exact thing. You mean pharmacology dosages, tips to learn? True, but honestly, we do it. Yeah. Pharmacology. Anita, what context do you mean? Like, I'm trying to really understand. It says, pharmacology dosages. Like, you're talking about like morphine, like 0.5 milligrams, or like vecuronium, like 0.025 micrograms or something like that. Is that what you're talking about? By the way, don't be trying to push nobody. Don't be trying to give nobody no Vecuronium. Who do y'all think y'all are? Redondavant? Don't be out here like that. All right. All right. I'm sorry. Let me stop. Let me stop throwing shade on that lady name, even though she really, really messed up. So how to remember pharmacology, medicate. Like there's so many. There's so many. And you know the dosage for dosages for pharmacology, they're based off patients' weight and age, you know, but it isn't. But I learned to work alone. Well, Cass, you're different. I believe training needs to be one-on-one for at least 8 weeks. I believe training needs to be one-on-one for at least 6 months, but that's me. That's just me. I don't know if it's being greedy or people are just like, oh, that's too much. It's always about the bottom line. It's always about the bottom line, never about, you know, patient safety. But hey, what do I know? All right. I'm going to hang out for about another 4 minutes and then I'm gonna get off here. My ER had up-to-date farm books. No shame in looking something up. Oh, hey, so we have a what is it called? A program called Up to Date. And I agree with the 6 months. That's exactly what I'm saying. We have a program called Up to Date that's linked with our phone and it's linked with our punch-in account or whatever. And you can look up all the updated medication, like especially like when I was giving medication through central lines, PIC lines or whatever, you know, we were giving medication through the same line. So you need to know which ones are IV compatible, and Up to Date was great. And then there was another one I was out there, Hippocrates. Don't ever be afraid to pull out your phone and be like, well, let me see what Google says. Don't be afraid to do it because it is crazy. Like, unless you're giving a medication often, then you're going to know what the regular dosage is. And even if you will give that medication often, you need to know what the doctor's order says. Like, I've literally seen people are just like what was it? Like you give, like we used to have the pre syringes of, I think it's 1 milligram of Dilaudid, or it's 0.5 milligrams of Dilaudid or something like that. Right. And I'm trying to really think, but the doctor's order, I swear to you, it'd be like 0.03 milligrams of Dilaudid. I'm like, but what? And then you got to waste the rest of it. You're just like, but why though? Like, why not just give the whole thing? You know what I'm saying? So, yes, exactly. As an NP, I still look shit up all the time. Look, when I give medications, it doesn't matter what medication it is. I always have somebody verify it. Like, I'm just like, hey, is that what it's supposed to be? And I was like, is that 2? Is that 0.5? And they're just like, yes, it's 0.5. Why are you asking me that? Like, why are you asking me that? And I was like, because I need reassurance because I'm slow. So, it's better to look it up and know than not know. Facts, 100%. No, keep that in your pocket because you're going to use it in 15 minutes. Look, that's that ER trauma that you're talking about right now, right? So this hospital, look, all right. They were just like, I literally called the doctor. I was like, hey, so you put in an order for 0.3 of Dilaudid. And I was just like, they were like, yeah, he's not going to need that much. I was just like, he might need more. He was like, oh, okay, well, I'll put in the order for the other 0.2. And you're like, why, bro? Why? Like why? And I was just like, so, okay, whatever. So, yeah, so there's that. Exactly. So it's just like, yo, that you're thinking ER, you're like, I'm going ahead and hold on to this because I know you're going to need it. So, but all right. Shout out to all 61 of y'all in here that were in here rocking with me, asking all the questions. I appreciate all my seasoned nurses that are out there dropping y'all's knowledge, coming up in here. And, you know, I guess, what is it? What's the word I'm looking for? You know, I guess just paying attention to a dude who's just trying to, you know, make it out here. You know what I'm saying? So it says, hey, first clinical. Mallory, what's up? First clinical start next week. Any advice? I'm nervous. Be a sponge. Take notes. Jump in to everything. Jump in. You're amazing. I share with my Hey, shout out to hey, thank you. I appreciate it. But for you, Mallory, I would say, like I said, take notes, be a sponge, jump in, you know, get active, ask tons of questions. All right. Like I'm not saying be behind your preceptor, but be that puppy dog and follow your preceptor. OK. Be your puppy dog, follow your preceptor, get everything, get all the knowledge that you can, because as a preceptor myself, I love it when I have students because as they are following me, and then when I do get a second to actually talk to them about something, you know, I'm talking a million miles a minute and I'm just like, hey, do you get it? Or I'm just like, hey, come here with me. Like I'm a very like, hey, put your hands right here, get comfortable. All right. And so if you take that initiative and do that, like you'll get comfortable much faster. I gotta work on faking my confidence. Nah. So yeah, fake your confidence. But the moment that you touch a patient, then the fastest way for you to get there is to do it. You got to get comfortable doing it. Okay. But I appreciate everybody that was here. It's 7:30 now, so your boy has got to get off and go get his grub on and go. I guess go take care of my son. I guess, right? But I appreciate everybody who jumped on here. Like I said, make sure you guys follow. Make sure you guys share. Yeah, check me out on TikTok and all that other good jazz. As well as if you are going to graduate here like in December or taking an NCLEX in like January, or you don't graduate for like another, 6 months to a year, check out the 7-day NCLEX course. It is in its pre-launch phase, but it's $48 right now, y'all. $48, and you get it for a lifetime. I got surprises and everything in there that are going to be coming over the next few months for people that I call early adopters, right? So make sure you guys go over there and check that out. Like, you guys are the ones who help architect. Yeah, you missed it, Kayla. You guys are the ones who helped architect, the creation of that program. Okay. But if you guys don't have anything else, which I'm pretty sure you do, but it's all good. But I will see you guys on Friday. See if I can come up with some more questions and see how you guys like it. But until then, I hope you guys have a good rest of your week, and I will see you all on Friday. Bye.